There's a lot of different chemotherapies. The doctor is going to recommend the one that has been utilized for a specific cancer. Cancer is not one disease. Cancer is over 100 diseases. There's a lot of different kinds of cancers, and something like breast disease, for example, has a lot of subtypes, and it can become complex.
Now, I did a little bit of background reading, but I want to let you tell your own story. So can you give us some background and history on what drove you to create Cancer Doctor? I know it's a service that helps patients navigate finding reputable cancer treatment options.
Yes, it is. So cancerdoctor.com, and by the way, I don't own the company. I work for the company. I am the chief safety officer, and you can find us at cancerdoctor.com. And I've been with the organization since late 2016. And what we do is we invest our time educating cancer patients on why integrative and alternative cancer care should be their first choice instead of conventional care, which would be chemotherapy, radiation, or surgeries. We don't charge cancer patients a dime for anything that we do. And after we educate them, we connect them with those patients with the qualified doctors providing the integrative or alternative care. I personally conduct a 200-point safety audit in person with those physicians that are willing to partner with us in a transparent kind of way. Because obviously, in today's world where it seems like there's a new health crisis all the time, patients are suspicious of integrative or alternative care because their own doctor's telling them to be suspicious of it, or maybe a family member's telling them to be suspicious, or maybe they just have a healthy suspicion. And that's very fair. And so we only work with professionals that are willing to have us come on in and inspect their facility. It takes about 2 days to conduct the full inspection. We speak with all their medical doctors on staff, their nurses, their patients. We look at their treatments and their modalities. And if they are approved, we will post them on our website as a partner center. One of the things about those Cancer Doctor partner centers is part of the criteria, they must be providing this integrative alternative care at least for a minimum of 10 years to patients with cancer. In addition to that, we have to speak with at least 5 of their past patients that were there over 5 years ago, and we speak with at least 5 of their patients that were there in the last year. So they're references, and we do call them to review the level of care that they received at the facility. Obviously, in the case of somebody that was there over 5 years ago, those comments are really valuable. We're not actually gauging the survival, rate of the patients per se. We are looking to find out the quality of the care from the eyes of the patient themselves. Now, why is this important to me personally? How did I get involved with it? Because that was your original question. Back in 2014, my wife found a lump on her breast. And at that point, that obviously, like any family that would receive a cancer diagnosis, it set us off in a whole new way of life. I had already had a number of years working in the healthcare industry, a corporate background that I had. And I began to look for integrative and alternative healthcare providers because that is what my wife wanted. And obviously, in my way of thinking as a husband, the patient comes first. So if my wife is saying, this is what I want, then I'm going to look into it for her, right? And I'm going to have my thinking cap on, and I'm going to evaluate it. I'm going to inspect it, if you will. When I began to do that, what I found was that there wasn't anywhere on the internet, a website or something cohesive that was listing out the healthcare professionals that were providing integrative care to patients with cancer. So it became really difficult to find these institutions, basically. I did find them, but I was spending a tremendous amount of time on the internet searching and looking. And at that time, I said to myself, it would be great if there was a company out there that dedicated themselves to evaluating these healthcare providers and posting them on some type of directory. As a result, Cancer Doctor had done just that when I was introduced to the organization. That's how I personally got involved with the business of integrative alternative healthcare for cancer patients.
So it kind of kept everything like in one place, so they're not trying to find out a little, from here and there. So it just kind of streamlines the process for them more so.
Yeah, it's correct. Because when the patient gets a cancer diagnosis, Melissa, the first thing that generally happens is they're in a state of denial, a tremendous state of denial, as you can imagine. Everything from, oh God, why me, to I'm going to die. Oh no, I got to get cancer treatment. And they're absolutely not afraid of the cancer, but afraid of the treatment itself. And so they're traumatized, really. And once, depending how long that takes, I've seen people in denial for months. I mean, for months, not do nothing. They're just in denial. They're thinking this is going to go away like a cold or a flu or something. But nothing could be further from the truth. But once they begin to do something, whether go get conventional care or they begin to ask themselves, is there something else I could do? Generally, some time has passed already. We exist to have an organized platform on cancerdoctor.com where they can get answers to their questions and connect them with facilities that we've evaluated, and they can set up, consultation with those professionals, right, to get some guidance on what they can do next. Again, we don't have any conventional healthcare providers on our website. It's 100% integrative, alternative in nature. And again, by way of reminder, when we say conventional care for a cancer patient, we're talking about chemotherapy at full dosages, radiation, a surgery. That's generally what we're talking about.
Okay. And I know you were also talking about, the 200 point, you went into that a little bit. What are some other things that includes when you go in there and you're trying to do an annual?
We want to get the information on the medications that they're providing the patients themselves. This would include the safety data sheets on the products themselves to review that. We also want to evaluate the equipment that they're using. There's different forms of equipment, like let's say light therapy, just as an example, right? Or a hyperbaric oxygenated chamber as an example. These would be pieces of equipment. So we want to evaluate how that's being done. We want to evaluate the patient schedules, because the patients that are enrolling in such a facility, they're going to stay there. In other words, they're going to get treatments and therapies every single day, either a minimum 5 days a week or 6 days a week. This looks very different than in conventional care, where a patient goes to receive chemotherapy maybe once every 3 weeks on a cycle. And so they're going once every 3 weeks. As I mentioned, in this case, they're going to a integrative treatment facility, and they're going to stay there. They're not going home, right? And this is going to last anywhere from 3 weeks, 4 weeks, 8 weeks, 12 weeks. It all depends upon the patient's condition and the doctor's recommendation, and obviously the commitment the patient is willing to make. But one thing is for certain: when they go get their treatment or their therapies every day at one of these facilities, they're receiving, I would say, on average, between 15 to 21 adjunctive therapies and treatments for their condition. You compare that to conventional care, where someone's going to go get their hit of radiation today for 15 minutes and they go home, and maybe they go every day for radiation, and depending upon the schedule that oncologists put together in radiology for them, right? But in the case of chemo, it's generally every 3 weeks. And sometimes it's a combination of the two. But that looks different, because in an alternative integrative facility, even your diet is going to be addressed. Your whole lifestyle is going to be addressed in these facilities. So it's a different way of thinking about your health and wellness. They are not compartmentalizing you. They are going to treat you from head to toe. That means emotionally, psychologically in some cases, along with the physical side of this, the disease itself, the condition. And the good thing about it is, when you're getting healthcare in this way, it's not just cancer that's getting addressed, but other underlying conditions that you may be facing are also getting addressed, and that's a good thing. So those are some of the differences that I would point out to you.
You also mentioned there are some pitfalls that some patients might encounter when they're trying to find a reputable facility, because they're stressed out, I'm sure, and this is the last thing they want to try to figure out.
I'll first start out with the pitfalls of conventional treatment, because this is important, because that's where most of the pitfalls are happening. All right. Most patients, and when I say most, we could just say all, but I'll just say most, are not aware that chemotherapy is a carcinogen. In other words, chemotherapy agents cause cancers as well. So the very drug that is being used to kill your cancer cells, bring cancer cells to life in the future. And everyone knows someone, or maybe everyone that they know that has had a diagnosis of cancer, that they get a reoccurrence of cancer. Maybe it's from the chemo, maybe not. Maybe the disease just came back. I'm not saying one way or the other. What I am saying is that a patient deserves to know, before they take chemotherapy, is there a risk of reoccurrence because you're taking an agent that causes cancer? That's a fact. That's on the material safety data sheets, the product data sheets. Just ask for them. And chemotherapy is not one agent. There's over, I think, 100 chemotherapies out there in the world. There's a lot of different chemotherapies. The doctor is going to recommend the one that has been utilized for a specific cancer. Cancer is not one disease. Cancer is over 100 diseases. There's a lot of different kinds of cancers, and something like breast disease, for example, has a lot of subtypes, and it can become complex. But it's a pitfall when the patient doesn't know that, chemotherapy can also cause a cancer in the future if used at these dosages, and also radiation as well can cause cancers. One thing that I heard once from a doctor regarding radiology, and this is someone who administers radiation, says, radiation is the gift that keeps on giving. That's what was said to me, face to face, out of his mouth. So it keeps on giving because it's changing the structure of your DNA in your human body, right? And it's very powerful. And it's a carcinogen as well. There are people that, when we talk about radiation, I don't want to go too much on a rabbit trail, but when we talk about a nuclear bomb, it's the radioactive fallout that we start talking about, right? Why? Because it's going to kill you. It's going to wipe you out. So those are pitfalls. Patients don't know the questions to ask of their medical doctors. If they go to cancerdoctor.com, on our website, you can find questions to ask your doctor, a free download. When it comes to integrative care or alternative care, one of the immediate pitfalls is the patient doesn't know what the terminology means. So I'll break it down for you. When we speak of alternative care, this would be a healthcare professional that is treating a patient with cancer with natural substances, for the most part. They're not using chemotherapies or radiations, etc. They're not necessarily opposed to it, but it's not something that they do, professionally speaking, right? These holistic, and I mentioned I just use a different word, holistic, and I say that because a lot of those that would label themselves as alternative would also use the term holistic care, right? But we're generally talking about something that is using less medicine and it's more natural. As an example, in the case of integrative care, we're talking about a medical doctor that is going to utilize medicine, maybe repurpose some off-label drugs for the cancer itself. They will use chemotherapy possibly, but not at a full dose. They will use it at a really low dose. Maybe that's 5 to 15, 20% of what a full dose would be. They won't give it every 3 weeks. Their profile may look different where they're giving the patient a very low dose once a week, but it doesn't have the horrible side effects. And as far as it being a carcinogen, you've just reduced the dose. As one oncologist once told me, it's the dose that injures or kills individuals. He's fond of saying that water is healthy for you, but if I put too much in your mouth, I will drown you. I can drown you with water, it'll kill you, right? So the point was made, obviously. In integrative care, it would also include, radiologists that are using radiation in a different way. It goes outside the conventional box, right? It would go outside of the cancer guidelines, and there are guidelines that oncologists and radiologists follow for cancer patients. They have to follow them in their field, all right? The other pitfall when it comes to terminology that patients are not aware of is the word treatment. Treatment, like I'm getting treated for cancer. When someone says that terminology means that you're being treated with chemotherapy or radiation, or maybe you're getting a surgery, okay? That is the only thing in the United States that is defined as a treatment for cancer. And therefore, the doctors in the integrative or the alternative cancer care space, you may hear the following. We treat patients that have cancer, not that they're treating cancer. Do you see the difference in what I just said? This is really important because a patient will come in, maybe they read something on the internet. There's a lot of information on the internet. Maybe they read about a natural substance. It kills cancer, like turmeric. And they're like, I want you to give me infusions I want you to treat my cancer with high dosages of turmeric, right? Or something. And the doctor ain't treating any cancer with that because technically cancer is treated with a chemotherapy agent or a radiation or a surgery. So there's some nuances, but it can save you a lot of frustration. You save you a pitfall just on terminology and trying to get to first base, right? The other pitfall that patients fall into is that they believe they only have one choice, and that's conventional care, nor do they ever go get a second opinion. I recommend for patients to get a second opinion, a third opinion, and to pay for those opinions if necessary. Most definitely get the opinion of your conventional doctor. Get it. Ask the questions. Say, can I see the product sheet for the chemotherapy that you're recommending to me? I want to take it home and read it. And on there, it's going to tell you the side effects, right? On those, dosages based on the paperwork. And I would also, at that point, get a consultation with an integrative or alternative physician about how they would approach it. Get 2 or 3 opinions. Please take notes. Have your caretaker, your husband, your wife with you, maybe an adult child, but someone that can be another set of ears for you, right? Record the meeting. Record the call. Tell the doctor you're going to record it because you can't remember everything. It's very stressful. It's traumatizing. That's a pitfall if you're not taking notes. Take very good notes. And then after that, it's gut check time. Say your prayers. Make a decision on where you will go if you need intervention, at that point in time. Not everybody needs to intervene immediately. And by immediately, I mean now. Some people, they may have a month before they make a decision on what they want to do. Others do not because the cancers are different. They vary from person to person. But the one thing I want to say is that a choice of one is a choice of none. Doing multiple consultations with different healthcare providers, now you have some options on what you can do. I wouldn't pit those providers against each other, say things like, well, this other doctor said this. That doesn't matter. You're talking to this professional. All you want to hear is their unbiased approach to you, how they will address you. You can evaluate with your family what the 3 different consultations look like and then make a decision on who you want to go to. When it comes to intervention, we only recommend the partner centers that we have on cancerdoctor.com. We have, just to name some, there's Utopia Wellness in Florida. Dr. Carlos Garcia is doing a fine job treating patients with cancer for a long time. We have an Oasis of Healing that's out in Mesa, Arizona. Dr. Thomas Lodi, he's been addressing this for many, many years now, does a good job. We even have a center out in Tijuana, Mexico. Contrary to popular belief, they're not killing people in Mexico with cancer care. That's a lie. I've been there many, many times. Furthermore, there's over 800,000 Americans that go to Mexico every year for healthcare purposes. So if they were just dying left and right, they wouldn't be going. But the center that we work with out there is a Immunity Therapy Center, and Dr. Carlos Bautista is a fine physician that's doing a good work out there. So those are just some examples that I'm listing out to you for the benefit of your audience. One other thing that I will say to you that's really troubling right now is that there's a lot of new cases of cancer, and obviously there's a lot of cancer that's going around. But in the last few years, the cancer registries worldwide have a higher number of cancer patients in them. When you're diagnosed with a cancer, your name goes in a book, and these books are all over the world. Those books have more people in them in the last few years than they had in previous years. And the only thing that changed in the last few years and with people's healthcare was a shot that was given to people for COVID. And this is not a conspiracy or anything of that nature. This goes back to being an educated individual and asking the hard questions. Many vaccines, in the case of, let's say the Pfizer vaccine for COVID, the mRNA shot, they did not have any carcinogenic studies on it. They cannot tell you that because they didn't do it. Now, that's a problem because shots are very powerful. They change things in your body, right? And though correlation is not causation, scientists are very clear about that. Correlation is not causation. In other words, just because people started getting a COVID shot and just because the cancer number started to rise, that doesn't mean that's the cause, right? The correlation is not causation. True. However, correlation is something to be suspicious of nonetheless. Something changed. What has changed? Another example would be simply the food we eat, right? Over the last 30 years, our food supply has dramatically changed. We are not eating today what my grandmother ate. It's different. And that's going to have an effect on the human body. So there's some real important questions that patients need to answer for themselves because there are higher rates of cancer that are taking place. And the cancers that we're seeing right now, some of them, not all of them, they're being labeled as turbo cancers because they're so aggressive. Patients that are between the ages of 20 into their 30s are being diagnosed with a cancer that's already a stage 4. It's not early, it's metastasized.
Wow.
And it just kind of like makes its appearance. This is troubling. 20-year-olds should not be getting cancer. 30-year-olds should not be getting cancer. There are young ladies, I've met them in their 20s developing breast cancers. That should not be happening. Children are developing cancers like never before. Children should not get cancers. So something is really wrong with the environment that we live in, what we're putting inside of our body, what we put on top of our body by way of shampoos, conditioners, or what have you. There's a lot of carcinogens. The time is now to be proactive regarding your health. Health is wealth, and your health is sacred. I advocate that everyone should begin investing their own hard-earned money into the healthcare providers of their choice that have a head-to-toe approach. They're going to address the entire person, their diet, their mental health, their stress levels, all of it, because all of it is going to contribute to your health or to your demise. And it's something to take seriously in the world that we live in today.
Yeah, it's amazing because, I mean, this is just something, it's like, it's an animal, but, there was, we have a horse. So it was diagnosed with something that was more for its neurological. So, for example, with him, they said to us, okay, now that he's kind of beat it, it's going to remain dormant, but don't get him vaccinated anymore, because it will bring down his immune system. Do not, all these things are like, don't do it because it will, stress, all the different things. And it's so strange that can bring that back. So it's like, it's lying dormant. But
I always tell cancer patients that this thinking with cancer, that it's like a flu or a cold, I'll treat it, I'll beat it, and then I'll go back to my old way of life. That's a recipe for disaster. That's not how this works. We are talking about you're in it to win it, to beat it, in a complete lifestyle change that you're never going back to. You're not going back to that old way of life. Things do lie dormant. And if you subject the human body to an environment that it didn't do well in the past, I think it'll do well in that environment in the future. You are changing your environment with what you eat, clothes you wear, the air you breathe, and anything you put in by way of drugs or vaccinations or whatnot. Vaccines in particular, there are more vaccines today that are given to children than at any time previously. And the children are not healthier. Matter of fact, we have more childhood diseases and conditions that we're seeing that I didn't see them growing up. I never saw a child that was autistic when I was in school. It did not exist. Today, a child will be vaccinated from the time they're born to the age of 18. I think it's over 70 vaccines. Some of these are heavily combined in the first 2 years of life, and even right out of the womb, they're giving you a shot. And there are medical doctors that have discussed this, that there is no need to be giving an infant, these particular vaccinations, that even the risk of the child contracting this is really almost low to none. And there's a higher risk of being injured from the vaccine itself. So the side effect, right? There is no medication. There is no vaccine. Hear me again. There is no medication. There is no vaccine that doesn't have a side effect. If you don't believe me, ask for the product safety data sheet. They have the data sheets. They have to give it to you. It's your right. It's your body. You do not have to submit as an adult to anything that you do not want to do in this country. All right? In the case of children, unfortunately, that are under the age of 18, if they get a cancer diagnosis, they have to do the standard of care. Or their parents are facing the sad reality of their child being taken away from them so that they could be treated conventionally, right, by the authorities. That's a sad reality. Once again, health is wealth. Being proactive pays off. I encourage everyone listening to the sound of my voice to be as proactive as possible when it comes to their health. Rearrange your life, do whatever you need to do to make sure you're investing in you, because without you, there's nothing left. Without you, your spouses, your children, your family, your friends, those that love you are not going to have you around. And we're all going to die. That's not the issue. We know this. The question often is, how would we like to die? Most people I meet would like to die in their sleep. Because they don't want to feel any pain or suffering, right? Me too. If we invest in our health, of course there's no guarantees in this life. We could get in an automobile accident and our life is over. However, all things being equal, if we invest in our health, and at a basic level, that means changing what we eat and beginning to exercise, those two things alone, there is stacked provable data that will alter your health for the better. It'll change your way of life, and you're going to reduce the risk of these diseases and exiting this world in a painful way. If you'll just do that for the rest of your life, change how you're eating, begin to move your body, get outside and get some sunshine, it could have a miraculous effect on your health for the rest of your life.
Yeah, that's the other thing too. I didn't even realize it, like sun, because we have to stay out. We don't want to get too much of it, but it's very important as well.
We don't get any sunshine anymore. Unlike my grandfather's generation, they all, the men worked outside. I mean, everybody, there was a lot of work taking place outside, right? Not only do you get vitamin D from the sun, the sunlight, when you go out there in the morning, it regulates and sets up your circadian rhythm in your human body so you can have a better night's sleep. And anybody that has been out of the sun every day knows that their sleep is generally improved if they've spent time outside of the sun. Why is that? Well, there's a biological reason it's taking place, and we won't get into all of that. It's simply to say that there's a lot of things that won't cost you any money whatsoever that will improve your health as well. Just going outside to breathe fresh air will improve your health. Deep breathing outside will improve your health. The air quality inside of your home is not as good as the air quality generally just outside your front doors, okay? Because these buildings that we're in, whether it's our office space or our home, are concealed, and every pollutant is just entrapped inside of that space, right? Open your windows, let some fresh air come through the building, right? These things are important. They sound basic, and they are basic, but they can have a positive effect on your health and wellness.
Well, I really appreciate you coming on today and talking to us. And now, how would people find more information if they'd like to?
The easiest thing is just go to cancerdoctor.com, cancerdoctor.com. If you want a free consultation with us, and again, we're not medical doctors, but we're happy to review your case, and we can redirect you to some physicians that you should inquire with, right? Just go to our webpage, scroll to the bottom. There'll be a place where you can contact us. Fill out the information, or if you want to contact a doctor directly that you find on cancer.com, do so. Especially if you need to intervene, contact a partner center. Partner is the key word. The second thing I'll say to the audience is this. Cancer Doctor is having its second annual fundraising event where we look to raise $100,000 to give away to one cancer patient. And we've teamed up for the second year in a row with a nonprofit organization that's in the integrative research space. And the name of that organization is Cancer Guide Research Foundation. And you can find them at cancerguide.foundation. And at the top of their website, you'll see something that says we're running 77 miles to raise $100,000 for you. And if you can give, if you're someone listening to this that can donate, it's fully tax deductible, just $5. Please make a donation to serve the patients that are looking for integrative and alternative care, because health insurance, once again, doesn't pay for this. And also spread the word. If you can share this information with anyone that could give to the cause, we would be very thankful if you were to do that on behalf of all the cancer patients that are getting diagnosed. And there are over 5,000 diagnosed today, and there will be over 5,000 diagnosed tomorrow as well. And it doesn't end. It just is consistently over 5,000 people every day. And so we need your help to get the word out and spread it.